Hi everyone, in this video we're going to be analyzing the secondary prompts from Emory University School of Medicine. It is ranked by the US News and World Report as a Tier 1 medical school for research, and they place a very heavy emphasis on clinical experience starting from your first year in med school. They also have a very close partnership with the CDC that opens up a lot of very unique opportunities for students. But what's tough is that Emory's acceptance rate of about 2 to 3% is similar to a lot of the most elite medical schools in the country, so you will definitely be up against many of the very best applicants. And something else to be aware of as an Emory Med applicant is that they also require a minimum overall MCAT score of 502 and then a minimum section score of 124 for each section, just in order for your application to move forward to the secondary stage at all. But meeting those benchmarks is really just kind of the tip of the iceberg, because you also will need to submit essays that really emphasize your strengths and demonstrate your commitment to Emory's mission. So just a quick heads up before we jump in, if you're looking for more in-depth secondary essay writing strategies, you can check out our YouTube series on the essay writing process for each of the 6 main secondary prompt categories. But you can also visit the Secondary Essay Premium Example Hub after watching this video, which contains a sample essay and analysis for each of these Emory essay prompts, as well as for every other essay prompt that's required by over 150 MD and DO schools. There are over 1,600 essays in total over there. Okay, let's take a look at this first prompt from Emory. We will be looking at the 2026 to 2027 prompts because they're the most recent ones available at the time of this recording, but if they change in future application cycles, we will of course update the resources on our website. So this first prompt reads, list your entire curriculum plan for the current academic year. If you are not currently in school, please briefly describe your plans for the coming year. You have 200 words to respond. And this one is a little bit unique because rather than giving the optional gap year essay where applicants who are already finished with their bachelor's when applying to med school explain how they're making good use of their time, they are actually opening up that question to everyone. In this prompt, whether you're currently finishing up your degree or you graduated, 10 years ago, the AdCom still wants to know how you've been spending your time inside or outside of the classroom. The most important thing here, though, is to really provide them with concrete details. So if you're still in school, they ask you to list your entire curriculum plan for this year. And we recommend adding some context to that list. So explain why you chose the courses and research opportunities that you did, and describe how you believe those courses will prepare you for med school in as specific and concrete of a way as you possibly can. And if you're not currently in school, then you want to describe what you intend to do with your time between now and starting med school, just as you would with any gap year essay. So will you be getting any clinical or research or shadowing experience? Will you be taking any classes on the side? Again, try to provide context for your choices and connect the dots for them so they understand how you're going to make the most of your time in the upcoming year. Okay, moving on to the second prompt, it says, briefly describe your health-related experiences and be sure to include important experiences that are in your AMCAS application, as well as any recent experiences. And again, you have 200 words. So the wording of this one is really broad, especially for a prompt with such a small word limit. And in order to keep your response really focused and relevant, try to make sure that you don't just repeat what you wrote verbatim in the AMCAS work and activities descriptions. Instead, pick out a few of your most impactful health-related experiences. Those can include, volunteering, paid work, research, any firsthand experiences with healthcare, like if you were a loved one spent time in a hospital even. And then write about the role that each of those experiences played in the development of your interest in healthcare or your understanding of what it means to be a great physician. Okay, and then moving on to prompt 3, it reads, briefly describe your interest in Emory and the Emory degree program that you have selected. You also have 200 words. This is a pretty standard Why Us essay. You need to focus your 200 words on demonstrating your fit for their school, meaning why they are a great fit for you and also why you're a great fit for them. So take some time to get familiar with their institutional mission and values, and then show them how you've demonstrated those values in your own experiences. Also make sure to mention specifically why you chose the degree path that you chose, MD, PhD, one of their other dual degrees, whatever it may be, and how will that specific path and its curriculum prepare you to meet some of your specific career goals. Okay, for prompt 4, We have Emory School of Medicine is committed to recruiting and educating medical students who will help deliver quality healthcare and will promote the health of our patients. In our community, this includes learning about and addressing the healthcare needs of our most underserved populations. Please describe any of your activities that have been in service to underserved communities. You only get 200 words for this one as well. And this is an interesting one. This is cool. It can be sort of approached as an extension to the previous YS essay. We covered earlier that Emory places a really strong emphasis on clinical experience, right? And that includes a lot of opportunities for med students to serve the local community. So they want to know where your values and priorities are. And the implied question here is really something like, what value do you place personally? What do you place on community? And how have your past actions demonstrated that value that you have? And as a future physician, also, how will you continue to strengthen that relationship with the community? So, just like with pretty much any other essay, you want to remember the importance of storytelling here. Don't just list off a few bullet points from your activities section. Tell a story. You could tell stories, multiple, but you probably won't have room within 200 words. But tell at least one specific concrete story that focuses on your relationship with individuals in an underserved community, whether that be a clinical setting or somewhere else, and then describe how those experiences helped to shape your personal and professional goals. You don't have to frame yourself as the hero here. In fact, you probably shouldn't. Just try to be transparent about tough lessons that you've learned and how you've grown as a result of those. And we also recommend identifying some specific examples of opportunities at Emory or Emory University Hospital that you want to get involved in. And if it makes sense to do so, relate those back to your previous experiences and explain how you plan to continue learning how to meet the needs of underserved communities there. Okay, let's move on to the final prompt. And this one asks if you have any updates or new information to report since you have submitted your AMCAS primary application. Please briefly describe them below. Again, you have just 200 words. So this is your typical additional information essay. And it does read like an optional prompt, but you should answer it if at all possible. So don't make things up or embellish, obviously, but think hard about what you've been working on since submitting your primary application. You should definitely mention big things like research, awards, discoveries, anything that is going to look really impressive on a resume. But less obvious things can also be worth mentioning. So, for example, have you had a particularly interesting patient interaction recently? Or have you reached, a milestone or achieved a personal goal in your research or clinical experience? So those are worth mentioning as well. Have you had, a light bulb moment that really sparked a realization about your career goals or your specific interests in medicine? All of those things could be worthy subjects for this essay, but you'll need to keep it fairly brief and specific because you only have the 200 words. All right, and that is all for Emory. So we hope that this helps you as you work on your Emory secondaries. And if you're in search of sample essays for these prompts, you want to see what it actually looks like fully fleshed out, or you're looking for sample essays for over 150 MD and DO schools, please check out the Secondary Essay Premium Example Hub. It contains over 1,600 essays in total. All right, take care.